Thank you so much. On behalf of the Board of County Commissioners and all of our local officials, and on behalf of state officials that are with me, thank you for coming today. We have a task before us, and we're going to do our very best collectively to share with our community as much information as we can about the hepatitis outbreak that we're dealing with here in Martin County. I have with me several state elected officials. Senator Harrell is going to take my place here in a second and introduce everybody, but what a privilege to have our Lieutenant Governor, who I know personally and have the privilege of serving with in the Florida House here. And then we have epidemiologists, we have all kinds of people. And I really do hope at the end of the day you have all your questions answered and that we can put some fears to rest. And I think that with transparency and a strong educational effort on all of our behalves in the county and state government and congressional, Congressman Mass, we're a privilege to have you, that we'll leave here this morning knowing so much more than we know now. So with that, my privilege to introduce our Senator, Gail Harrell.
Thank you. Thank you so very much, Sheriff, and we are so delighted that you were able to host us here today, and I can't tell you how much I appreciate you all being here. I appreciate all our wonderful elected officials and community leaders who have come here to be with us today. As you know, we're experiencing an outbreak of hepatitis A, and for me to see all our government working together from our federal level, our congressman here, our lieutenant governor, all our local officials, our state officials working together to really make sure that we are addressing this serious health concern. And we have with us, and I want to recognize all our electeds, and I just saw our superintendent of schools come in. We have our lieutenant governor, of course, Jeanette Nunez. We have Dr. Karina Blackmore, who's the state epidemiologist. She will be here to answer your questions in just a few minutes. Of course, our Congressman Brian Mast, and the federal government plays a significant role in this because, of course, the CDC is really the overarching entity in the entire country that deals with communicable diseases. So we are in contact with the CDC, our health department, our Department of Health at the state level, as well as our local health department. I'm delighted to have Mary Lynn Magar, who's Speaker Pro Tem. Thank you so much for coming from Tallahassee. And also our local state representative, Toby Oberdorf, who is also here. And of course, we couldn't do this without Will Snyder sharing his wonderful facility with us. And I'm so delighted Rob Lord, who is the CEO of Martin Health Systems Cleveland Clinic, and who's really here on some of our local health issues. And if you have questions, he would be able to answer some questions for us. We have Kelly Layton, I believe, our wonderful city of, there she is, yes. And Becky Bruner is here. Becky, there she is over here. Oh, and Stacy Heatherton is here. And of course, our wonderful county commissioner from South County. Thank you for being here. Oh, and Ed Campy, our chair, he's going to speak as well. So we look forward to hearing from you. And then our superintendent of schools is here as well. I am so delighted. As you know, we've had 19 cases in Martin County, 3 deaths. This is very serious, and we really want to address what the cause is, but most importantly, how do we prevent this from happening? That is absolutely the message. And, you know, good old hand washing, you know, that's basic. Vaccines are absolutely important for those who are high risk. But the level of investigation I want to make is very important. And there's no quick answers, so if we're looking for instant answers, I don't think we're going to get that today. This is CSI level investigation that has to be done. And we are here to answer the questions. We have the experts to do it. And I want to acknowledge our Lieutenant Governor for coming. This is how serious our governor takes this. This is how serious our state, our national, and our local officials take this. So with that, I'm going to turn this over to our wonderful Lieutenant Governor, who I also served with and have had the honor and privilege to know for many years. Jeanette Nunez, please.
Thank you. Well, good morning. Thank you all so much for being here. Thank you, Sheriff Snyder, for hosting us, Senator Harrell for that introduction, and to all of our elected leaders that are here, because this is an important topic. And so again, I want to thank Senator Harrell for hosting this important press conference today. And again, thank you to Congressman Mast for being here and our state representatives, our local officials. Seems like I've served with quite a few of you in the legislature, so it is a privilege to be here today. To Martin County residents, I want to assure you that we are committed and diligently working to investigate the cause of these local hepatitis A infections, and we will leave no stone unturned. I am having daily meetings with the Department of Health to measure our progress in this investigation, and as we continue to investigate, we will work closely with other states as well as the CDC. As Senator Harrell mentioned, it's an important component of this. The Florida outbreak is indeed part of a national outbreak, with more than 15,000 cases since 2007 nationally. And Florida, obviously being the third largest state in the country, it is unfortunate, but not surprising that our case numbers have also been rising. Florida currently has more than 1,200 cases reported between January 2018 and April 6 of 2019. Educating the public about hepatitis A, how it's transmitted, and what the symptoms are is also critical at this time. It is important to know that hepatitis A is rarely fatal. It is usually spread when a person unknowingly ingests the virus from objects, food, or drink that have been contaminated. The disease can also spread from close personal contact. The Department of Health is sharing real-time information with the media, online and on social media as well, about how you can protect yourself and educate yourself about hepatitis A. Getting vaccinated is the single most important action people that are at risk can take in order to avoid getting hepatitis A. And so please talk to your healthcare providers. Please talk to your physicians. Make sure that you understand if vaccination is right for you and how you can go about doing that. And so at this point, I would like to introduce Dr. Karina Blackmore, who is the state of Florida's epidemiologist. She will provide more information about how Martin County residents can best respond to this situation. Thank you all so very much.
Thank you very much, Lieutenant Governor Nunez and Senator Harrell. As the Lieutenant Governor mentioned, Florida is part of an ongoing national outbreak of hepatitis A with more than 15,000 cases nationally and 1,200 cases reported in our state. We're taking this issue very seriously and are providing real-time updates to the community as we investigate the source of these infections. The hepatitis A virus is usually spread when a person unknowingly ingests the virus from objects, food, or drinks that have been contaminated with small, undetected amounts of stool from an infected person. The disease can also spread from close personal contact with an infected person, such as through sex or caring for someone who has hepatitis. Symptoms usually develop 2 to 6 weeks after exposure and can initially mimic stomach flu with fever, nausea, vomiting, and abdominal pain. Many then also develop jaundice, which is a yellowing of eyes or the skin, and dark urine and clay-colored stool. Hepatitis A, as the Lieutenant Governor mentioned, is seldom fatal, but it's very important that if you do have some kind of underlying health issue like a liver disease or kidney disease or clotting disorder, that you seek a consult from your doctor to make sure that you don't have serious consequences from this virus infection. The very best protection against hepatitis A is to get vaccinated. Please talk to your doctor about whether the vaccine is right for you. The spread of hepatitis A can also be prevented by practicing good hand hygiene, including after going to the bathroom and before preparing or eating food. We have set up a hotline where you can call for additional information about hepatitis A. It's available between 8 a.m. to 5 p.m. Monday through Friday, and the number is toll-free, 844-225-5364 or 844-CALL-DOH. You can also email us at hepa@flhealth.gov.
And the doctor will be available to answer questions after we have some comments from our local officials. And please, I'd like to invite Congressman Mast to come to the podium.
As was mentioned, obviously identifying where this threat comes from is a piece of it, but preventing is also a big piece of it. For our role, we've been working to make sure that certainly within our VA facilities there's access and supply for the needed vaccinations for everybody, and making sure that not just vaccinations at the main hospital down in West Palm Beach, but those vaccinations are available for all of our veterans coming into our local clinics as well, and that there's adequate supply there. So making sure, as was pointed out, that the vaccinations are readily available for those that wish to seek that it's right for them are available. That's what we're working on our front, and also ensuring that the CDC is on call and ready to provide their support as well.
Thank you. Thank you very much. And as I said, this is a coordinated effort between all levels of government to address this. And I'd like our Speaker Pro Tem of the Florida House, Mary Lynn Magar. We're so honored to have you here.
Thank you. But more importantly, I represent Southern Martin County and Western Martin County. And like many of you, I have probably more questions than I have answers. And I'm determined to make sure that we get the answers to those questions, and that the state resources that we can make available are made available to Martin County, and that we make sure that we address this terrible situation immediately. Thank you.
And I'd like to recognize Representative Toby Oberdorf, who represents the northern section of Martin County.
Thank you, Senator, and thank you all for being here today. I will reiterate, ladies and gentlemen, wash your hands. Wash your hands, wash your hands. To our restaurateurs and to our business owners, have a talk with your staff. Have a talk with the people that are associated with this. Educate them on the clean health that they should be having associated with this. Restaurateurs, I feel you. We understand that. That's why we are working hard, and we are committed as a state, as a local body, to also be working hard to find out where this is coming from, and to find out how to take care of these issues that are associated with hepatitis A now and get it behind us. We appreciate all of you being here today and educating our public. And again, thank you to the sheriff, to the senator for hosting us today. Thank you.
Thank you, Representative. Just for clarification, what I think would be the most orderly is we anticipated having too many people on the platform to be able to get all the people that have information. So let's do this so it's clear. We have state and federal elected officials up here. Let's open up for questions for them. And then when your questions are done, we have our chair of the county commission is here. Our school board superintendent is here. I know that the children and their parents are extremely concerned about this. We have other officials that will be available for questions. So with that, I'll turn it back over to Senator Harrell, and then she can help facilitate getting all of your questions answered. Just so that you know, we paid for the rent on this room for all day. So we're not going to rush through this. We'll stay here. We all have questions. I have questions. I get comments and questions from people on Facebook, and I have to tell them I'm a certified first responder. I am not an epidemiologist. And so our role in this actually would be, as I turn it back over to our senator, is that we have a staff of highly trained investigators, and we're glad to help. We can go through credit card records with subpoenas, and we can supply detectives if they're trying to get at the source, which I think is what we all want to know. Where is this coming from? Our detective captain is with us, and we're glad to throw our detectives into this, but we're not the lead agency. And with that, Senator Harrell.
Thank you so very much, Sheriff, and we so appreciate your being here. And I think really our state epidemiologist is the one that has the answers to your questions, and also any of us as officials, as electeds. We have our county commission here as well, and certainly the schools, children are a prime interest for us. We want to make sure they are protected as well. So I'm going to open it up for questions. So I'll recognize you right there.
Yeah.
Yes.
This was for Sheriff Snyder. Sheriff Snyder, is it true that your office offered to help investigate, but that offer was declined by the health department?
The question is, was it true that our office volunteered to help investigate?
That you offered
yes,
to investigate these cases, but that offer was declined.
Well, the offer I just made, we made initially when we had our first press briefing. I hate to use the word declined, it hasn't been accepted yet. So perhaps they haven't needed us yet, I just don't know, but we really do have good detectives and we can follow things up.
And it seems to a lot of us in the media and in the public that this is an all-hands situation as more and more cases become made public. Why is that? Why are you not investigating?
Yeah, the question is, why are we not investigating? The answer is, we're not the lead agency, and without files and referrals and knowledge of exactly where these victims live, that has not been disclosed yet. Perhaps we will get a better feel today. I mean, short of subpoenaing, issuing a subpoena for State Department of Health files, I'm at an impasse.
Maybe the health department can tell.
I'm going to do this. I'm going to get let me get Mr. Gil-Smart.
I see via the handout that the State Department of Health is not going to identify the location of the infections. Given that in the past, with previous health issues such as dengue fever, rabies, the location of the infection has been identified, what's the rationale for not telling us where these infections
Yeah, the question is, what's the rationale on not disclosing it? I see the doctor warming up to my right, so I'm going to turn that question over to her. But I think you had a question for me, sir, before I...
Well, also for the health department was, why haven't they asked you for your help?
Yeah, the question is, why haven't they asked me for our help? And our good doctor is, right? Lieutenant Governor.
Lieutenant Governor.
And we'll certainly let the doctor respond to that. As indicated, the lead agency for this investigation, which is an epidemiological investigation at this point, is the Department of Health. They are eager to work with all partners, and they will do so at the time if and when necessary. Right now, we are investigating the cases. Dr. Blackmore will discuss more at that level, but it's important to note that we have to go through an extensive and exhaustive process of meeting with individuals that came into contact with those infected, trying to find linkages. It's not just as easy as providing a map with red dots as to where those people were, because obviously there's a transient nature of the population, but Dr. Blackmore will further discuss that.
If I could just ask one follow-up to that. Our newspaper has been in contact with one of the infected couples who told us that it was 10 days after this female was infected that she was finally in contact, despite repeated calls from them to the health department. It took 10 days for the health department, the local health department, to call them to get more details about her infection.
Well, I obviously haven't spoken to this individual, but our focus right now, as indicated by this hotline that we have, 1-844-CALL-DOH, we have allocated additional resources that Dr. Blackmore will discuss with regards to making sure we have enough people investigating this issue, but we'll be happy to look into that.
Doctor, would you come forward?
Sure. So as the Lieutenant Governor said, we have an agency of 13,000 employees and a large group of epidemiologists. They are very highly trained in investigating disease outbreaks, and we definitely appreciate any partner interest in working with us. But what we have done is we've mobilized staff from other county health departments and from the state health office on site here in Martin County to help work on investigating this situation. And as Lieutenant Governor said, it's a very meticulous process. We want to go back and work with cases, work with family members of those that unfortunately are deceased to really verify what activities they had, where they ate a month ago, 6 weeks ago. And when we get a picture of that, we will start to understand what actually happened here in Martin County.
So where do you stand right now in that investigation as far as finding out where the source may have been?
We're in the initial stages still. We are doing more laboratory testing, for example, on samples for the disease. We're sending specimens to CDC for that laboratory testing. We are in the process of contacting or have had some contact with family members. Of course, we want to be tactful and respectful to get more information and try to then retrieve calendars, credit cards, and other documentation that will help us understand what happened a month, 6 weeks ago, and it's definitely working on that very thoroughly and meticulously.
Is there a time frame when you think you might have an answer?
I think we will know more within a few weeks, but like any CSI investigation, we don't really know exactly where this will take us. We take it step by step and in a very methodical way to just making sure that we understand exactly what happened in great detail, so that if something happened at that point that has bearings with regards to how we need to respond to this outbreak overall, that we can learn that and relay that to you.
Dr. you talked about, does the onset of symptoms for this illness, and that some of them are delayed, does that present additional challenges to you?
Given, I personally have a hard time remembering what I did a month, 6 weeks ago. It's absolutely true that we need patients working with our cases, that they really work with us and thoroughly go back and recall what happened. So that collaboration is really important to us. And then very meticulously go through those events. And we are also looking at additional medical records to verify whether there are underlying health issues involved here. For example, we are going to do genetic testing of the virus to see if the virus that these deceased individuals had was in any way different from what we have seen elsewhere in the state and in the country, and we work closely with CDC to do that type of investigation too. So we are pursuing this on a number of fronts.
Can you address why, as my question was earlier, you're not identifying the location of the infections?
So we, when you talk about mosquito-borne diseases, we talk about it's mosquitoes that spread those diseases, and they are really focal. They just live in, for dengue, for example, those mosquitoes only travel 200 yards. And so for that reason, that particular geographic area is really important because people, if you go there, can get infected. In this case, the virus is spread by people, and people who may be working in other areas, so Martin County or other counties, people who may come and visit. To really determine where the risk is, we would need to track down the movement of all of these people. So the residential address is probably not where the transmission takes place.
But we know that 5 of the 19 people are from Palm City. Do you have reason to believe there are more people who are infected who live in Palm City?
We definitely have seen a clustering in Palm City, but I don't think that I believe that may be random, and we need to not home in on that too closely. We need to be open about it being a more community-wide outbreak, especially since we have 1,200 cases in the state, and those individuals, of course, could come to Martin County and visit with family and friends, and move the virus here. So definitely, I think. For anyone who is concerned about hepatitis A, or anyone who have health conditions, liver disease, kidney disease, weak immune systems, we really want those individuals to talk to their doctors about getting vaccinated.
So on the Department of Health website, it says that 70% of the people who contract Hep A get it through intravenous drug use. There's a strong overlap with the homeless population. What we know of those who've been infected here do not fit that profile. Does it suggest that the virus here may be either foodborne, something like that, waterborne?
So it is true that the national outbreak is centered around those very vulnerable populations, like you mentioned, the homeless, the drug users. But what's also really important is that in addition to them, it's their contacts and contacts of contacts. So they are community members. They may be working in different places. And then infect people who have who interact with them. So about in Florida, we know right now that about 50% of our cases have a risk factor like you're talking about, and then we believe that the rest of the cases have had close contact with someone in that sort of core community. Which again, since these are community members and family members, it still means that people at high risk for hepatitis A in Florida really should talk to the doctor about getting vaccinated.
Dr. Blackmore, to follow up on that, Martin County was at high risk for several days before we had that press conference last Friday, to notify the public. Why did it take several days before you guys put that message out there, and why did you notify the public sooner?
So the notification, so two parts to that. We have in the agency defined high risk as having had 5 cases of hepatitis A since January of 2018, which is a place where most of our counties is at this point in time. And we're using that to step up as a trigger for starting our vaccination outreach. And then, of course, in this community, unfortunately, you had these 2 deaths that came also last week. We had been in contact with the medical examiner's office on March 29th about these unusual deaths, but it wasn't until April 3rd that anybody suspected that it may be hepatitis A. And then, per our normal process, being meticulous, as I mentioned, we have samples like that go to our state lab for confirmation to just be absolutely certain, because this was a little bit unusual. And those results did not come back to us until late on Friday afternoon. So that was right in line with the timing of this notification.
We've been getting a lot of questions from the public, a lot of concerns, as you can imagine. One of them being, right now, is it safe for them and their families to go to restaurants to eat out? Because this obviously can be spread that way. Is it safe for them to do that?
It is safe for them to do that. It certainly, we are looking at foodborne transmission as one angle, and it is really important, of course, that the restaurant community work with us, and as always, make sure that any sick employee stays home and does not go to work. But we have no indication at this point that this outbreak is spread primarily through restaurants. We've had several. When we do have cases, as I mentioned, we interview them. We interview them about how they were exposed. We interview them about what their occupation is. And when we learn that they work in a food establishment, we then talk about what kind of work they do and whether they have put the public at risk. And in several occasions in the last few months, we have gone out to the public where we've had situations where the public have been at risk. And if we are able to do that within 2 weeks of exposure, we can actually vaccinate those exposed and prevent them from getting hepatitis A. So that's why we interview everyone, to have that opportunity to identify contacts to prevent further transmission.
Do we have any information on the ground zero patient in Martin County, or when that first began? I know we're talking the beginning of the year, but how do we think it started from this one person and went from there? Do you have any information on that?
So we have no indication that there is one ground zero patient in Martin County, given that we have such a large number of cases statewide and nationally. We have, as the Lieutenant Governor mentioned, 15,000 cases nationally. Florida is a popular state to visit. Martin County is a popular state to visit. We have no reason to think that we haven't had multiple high-risk individuals come to Martin County over time.
Where's the CDC on this, and are they coming to assist?
They are assisting us every day. I met with them in person last week. I had one conference call with them last week. We talked about this situation specifically on Tuesday. We work with them really closely. We work with other states who have more experience than we do with a larger number of cases very closely. CDC is assisting us, both, of course, with technical advice, but with the laboratory testing that I mentioned.
Doctor, with so many variables in this investigation, how confident are you that you are ultimately going to find the source?
It is going to be very challenging, given that we are having this lag time that I was talking about. But it really comes down to the community helping us, giving us all that detail that we need to put those pieces, the puzzle pieces together.
It sounds like you're asking the community a lot, and people might necessarily, chime in with those details.
And we, of course, can only get as far as we can if we don't have those details.
Have restaurants been ruled out in any of the cases here in Martin County?
We have not ruled out anything with regards to the cases in Martin County. We are turning over every rock to make sure that we learn.
With all due respect then, Doctor, how can you give us assurance that restaurants are safe to eat at in Martin County, given the fact that none have been ruled out?
The exposure that we're talking about here, the cases that we know about, they were infected more than a month ago, maybe even 2 months ago. So that doesn't really reflect what is happening today.
And at this time, are there any specific restaurants or even specific areas where restaurants are that we're thinking?
We don't have any leads at this point of a specific activity or restaurant. We are just gathering a lot of background information, and when we do start to see patterns where multiple cases give us the same kind of information, we definitely work really closely with other partners to investigate those leads, and that of course includes the Department of Business and Professional Regulations that regulates restaurants.
Does your office issue an alert to restaurants to maybe extra sanitize or do something? Is there an alert coming for all restaurants in Martin County?
We have communicated with restaurants and both in Martin County and statewide, working through our partners in the Business and Professional Regulation, but definitely we'll keep up that communication because it is really important that community works with us.
You mentioned the vaccine is one of the best ways to prevent getting this. Can you comment on the supply of the vaccine in this area, and will you possibly be setting up any type of vaccination stations locally throughout the community?
So we, in speaking with the national suppliers of vaccine, there's not a shortage of vaccine because of course, the great interest for vaccine in this community. There has been some temporary shortages. So, but it should be possible for pharmacies and other entities to order vaccine and have them available for this community very quickly. And I can't speak to exactly what the efforts are going to be for Martin County. We'll have Martin County Health Department talk about that, but they certainly are offering vaccines at clinics and are working to ensure that high-risk populations are vaccinated.
And along those lines, I'd like to ask Rob Lord to come forward. I know Martin Memorial Cleveland Clinic has been really gearing up for this. I know that they have vaccinated all their employees, and I'd like you to speak to the availability of vaccination.
Thank you, Senator Harrell. The vaccine is available at Martin or Cleveland Clinic, physician offices, and we've tried to make it where it's affordable for our local population. Don't go to the emergency room. That's not the right place to get this vaccine. It's also the most expensive place you can go to do that. So I would encourage people to contact their own primary care physician. I believe that the vaccine is widely available throughout our community at this point. To clarify something that Senator Harrell said, we are in the process of vaccinating our 4,500 employees. We haven't completed that. And I would also reiterate something that's been said several times. Wash your hands. It is the single best way to prevent infections of all kinds. But that's also very true with this condition. Another observation as I listen that I think is worth noting in terms of the challenges faced by the health department. Many of these infections are asymptomatic, and by that I mean they don't manifest themselves outwardly with an illness, or a person doesn't feel terribly bad. It is a self-limiting disease. It is not a chronic disease as we think of hepatitis B or C. It goes away. You get well. But as a result of the fact that it's asymptomatic and then it takes this period of time after you come in contact to start shedding the virus, many people could come in contact with it, have no idea. It's going to be very, very challenging, I think, to track down. Just my common sense tells me, simply because between asymptomatic patients are people that have been infected and others who have, it's several weeks before they discover this, and we're going back trying to remember every step that we took and every person we came in contact with. Very, very challenging situation. But we will get through this, and finally, very few people die. Generally, there's something else that contributes to that, another illness, another condition. So that's it for me. Thank you.
Hey, Rob, you mentioned that a lot of the people that might be most at risk may not be the kind of people that go to the doctor on a regular basis, don't have a personal physician to go to see. What about them? How do you get to those folks? And someone mentioned clinics or sites.
I think we need to work cooperatively with amongst these agencies. We do have some local organizations that do an awful lot of good work with that population. In addition, we have the health department that can get out there and get with the homeless population and try and provide access to that. What I can tell you is Cleveland Clinic will work cooperatively with state and local agencies, and we will do everything we can to be a part of the solution to this for our community. It's also, though, something we want to try and make sure we don't have panic in the streets. This is not a situation, at least as we see it right now, that warrants that. Yes, sir.
Rob, another question for you. You mentioned right when you walked up to the podium about making it affordable. The figure we've heard for as far as cost goes is $235.
We've dropped that significantly down to about $140, $150. I'm not exactly sure of the exact price at this point. But Scott Samples is here. Do you have that, Scott?
I think it's about 140, 145.
Okay, so we did that to again try and improve affordability. Many insurances do not consider this a covered service and will not assist with that. So we reacted to that, taking this step.
At this point, I'd like to have Clint Sperber, who is the director of the health department in St. Lucie County, and also he's coordinating the efforts across both counties on this from the local county health departments. And I'd like to ask him specifically to address the issue of the dealing with our homeless population and how we want to make sure our uninsured and underinsured are being served through our county health departments. So Clint, would you come address that, please?
Thank you, Senator. Again, I'm Clint Sperber. I am the administrator for the health department in St. Lucie County. So we have been doing targeted outreach for the past several weeks in this county, trying to get to those who we know are not going to come to the health department to get vaccinated. So we have been doing this for several weeks. We are also working with the Sheriff's Department to get some of the inmates who would be open to the idea of being vaccinated to work with him, and a few of those other hard-to-reach people. So it's the investigation, as we learn more about this investigation, we will figure out some of the next steps as far as a larger vaccination if that is needed. But specifically also the Senator mentioned for people who are uninsured or underinsured, we have been providing vaccine at the health department and will continue to do so.
Can you say, do you know whether any of those who've been confirmed as infected are homeless or among the homeless population?
I do not have that answer.
We do have that answer for you. Hang on. Doctor?
So at this point, 5 of the cases we have confirmed are in the population that are either homeless and or drug users. And like I mentioned, typically what we see statewide is about 50, and recognizing that probably is a slight underestimate just because we may or may not get the correct information from everyone, but we are seeing a component of the cases here fit that risk group.
You mentioned earlier whether if there were a situation where you found out that an employee of a restaurant, for example, might have been infected, that you would reach out to those who might have been impacted by this. Has that happened here?
No, we have not had any indication that we have had an infected employee in a restaurant at this point.
How about any grocery stores in the area? Have you been in contact with them, or same question regarding a grocery store?
So it's certainly part of our investigation when we try to figure out what are the type of activities that our cases have had, and at this point we have no indication that any of them are linked to a grocery store.
And those 5 cases you were talking about, that's just Martin County, correct? Not
That is correct.
Clint, is the health department going to accept Sheriff Snyder's offer to help investigate these cases?
We are working with our partners in several different avenues. You know, as Dr. Blackmore mentioned, we are an agency of approximately 13,000 employees. We do have support right now from my health department. We have support from a few other health departments across the entire state who are helping with the investigation. If we do get to a position where more assistance is needed, we absolutely will reach out. And in addition, as far as helping to vaccinate the inmates, so absolutely he is a key partner.
Several people have mentioned that it's very rare to die of hepatitis A. Sometimes it often includes some other element that may have gone on. Can you say, of the 3 people who have passed away in Martin County, were there other things going on with them, or was it just exclusively hepatitis A?
And that is still under investigation, but that's absolutely something, I mean, it is indeed very unusual, and so we are absolutely looking at that, looking at their medical records. Like I mentioned, we have specimens that has gone up to CDC to investigate whether there was tissue damage, for example, liver damage for the 2 individuals that passed away, the couple. So we are definitely exploring that, but we don't have the answers.
I mean, you mentioned the couple. I mean, how, you say it's rare to die of hepatitis A. How rare would it be for a couple, a husband and wife in the same home, to die of hepatitis A?
It is very unusual, which is again why we're really trying to turn over every rock so that to see if there's anything that we as public health officials can learn that we need to then, that has impact on the larger community and needs to be shared as far as how to better prevent these infections.
Dr. Blackmore, while you're at the mic, are there any other active hepatitis A clusters in the state comparable to the one in Martin County right now?
This is a little unusual, again, with the 2 deaths. We haven't seen very many deaths from hepatitis A, so that makes it a little unusual. However, we report somewhere between 50 and 70 cases every week in our state, and are investigating all of those situations very thoroughly. In a variety of ways, looking at risk factors, looking at risk links to restaurants, for example. We had one in Hillsborough County just last week. We certainly believe that the Martin County cluster is linked to this larger outbreak.
Is there a difference in terms of the virulence of strains of hepatitis A, or in other words, is it possible that the local strain is more virulent than some of the ones you see?
So what we know about the hepatitis A virus is that, again, we have the 15,000 cases that we draw from in this intelligence, if you will, is that there's actually a rather limited variability. In some international situations, there have been strains that have been a little bit more virulent and cause more liver failures and more deaths. We're absolutely exploring. We have no indication that that's the case, but we have the virus from these individuals, and we are sending that virus to CDC to just investigate that and making sure of that. But again, regardless of the strain, vaccination and hand washing is going to be the best way of preventing more infections. That we know.
So Dr. Blackmore, we have 19 cases in Martin County, 3 deaths. Are we considered one of the counties throughout the state that has a higher number compared to the average, or where do we stand?
So certainly it is a higher number than what we've seen historically in Martin County, and absolutely a very serious situation. Like I said, it's important to get in and vaccinate these high-risk populations early. But as far as numbers is concerned, Hillsborough County, Pinellas County, Orange County, Pasco County have more than 100 cases each, and Pinellas, I believe, has even more than 200 cases. So in that perspective, the case number here is still small, which again, it's an opportunity to limit the spread in Martin County.
If that's the case, then why are we making such a big deal out of this? If there's 200 cases in Pinellas County, why is 19 cases in Martin County? Why are we all sitting here right now?
We certainly appreciate the opportunity to make people aware of hepatitis A and the importance of getting vaccinated so that you do not become a county with 200 cases. But that's definitely the opportunity that I see.
Yeah. I can just
the Lieutenant Governor would like
as
to
well.
address this as well.
Obviously, as the doctor indicated, in terms of number of cases, Martin County isn't at the epicenter, but certainly Governor DeSantis and I are focused on this issue statewide. Given the unusual nature of 3 deaths in this area, we understand the gravity and we understand the community's concerns. So we're here, obviously, to share information. Most importantly, and you've heard it, but I'm going to say it again, in terms of good hygiene, hand washing, and vaccination, we really want to drive that point home. And so we want to make sure the community understands that this is not a time to panic, that things are transpiring. As the doctor said, we're investigating, we're doing everything in a meticulous manner to make sure that we get to the root, to make sure that we understand, and to make sure that the community understands that there are things they can do proactively to prevent this. But again, Governor DeSantis and I are very focused on this issue statewide, and we're going to continue to have these conversations with the media, with the community, with the elected leaders, because everyone cares. And we want to make sure that the elected officials that get the calls from their constituents, that they have answers, that they can direct them to 1-844-CALL-DOH, to the website, and provide them with the information that they need to feel that the Department of Health is working on behalf of all Floridians.
So anyone who can answer this question, just please. Because of the fact that where you are today in the early parts of your investigation, how can you be sure, and the latency period of what, 2 to 6 weeks, how can you be sure that this isn't brewing in other places here in Martin County, that it's brewing more than the 19 cases? Latency,
Doctor?
beginning of investigation?
Well, that's exactly why we're having this conversation, because again, the way you prevent that from happening, so to speak, is to work on the vaccination piece, to get high-risk individuals vaccinated so you don't have hepatitis A brewing in other areas or expanding as an outbreak.
Is it possible that there are individuals who may have passed away 2 months ago from maybe something resembling the flu, might have died of this and it wasn't identified at the time? Or autopsies routinely performed on those who died of Cleveland Clinic, for example, that sort of thing?
Yeah, I can answer.
And I think the sheriff might be able to assist in that answer.
Autopsies are not routinely performed in all death cases.
No, Sheriff, would you like to address
Yeah, just
that
real
normally,
quickly, the
or-
question was, how do we know that people who have died in the last few months didn't die of hepatitis-related causes? And do we routinely do autopsies? The answer is, we only do an autopsy on unattended deaths. In other words, someone who has died not under the care of a physician. I would speculate that the likelihood is, just getting what I'm getting from the doctor, that if someone died of a hepatitis-related virus situation that had been in good health prior, we would have done an autopsy, as we did in the cases in Palm City, and our medical examiner, picked it up during the examination of the victim's tissues. So probably not, but there's no absolute certainty. I think where the problem would be is somebody who was under the care of a doctor and had some type of chronic disease and then got hepatitis A, and the doctor said, well, they died from the underlying disease that they're being treated for. We wouldn't have done an autopsy. The medical examiner would not have done an autopsy, and we would not have known.
And I would like, before we go further, I know I've had many calls concerning our children. And children are a vulnerable population as well. I know we have our superintendent of schools. I wanted to recognize her, and I know she's got a couple comments she wanted to make concerning our children. And the idea is we want to make everybody as knowledgeable as possible, not fearful, but as knowledgeable as possible, and do what we can do to prevent it. So if I could ask Laurie to come forward and just address the children.
Good afternoon. Laurie Gaylord, Superintendent of the Martin County School District. And we were notified really of a lot of this happening about a week ago. And I have to commend our Martin County School District staff, our food nutrition services, because we were on it right away. One thing about food nutrition services, they're well equipped way before any type of outbreak because they follow all compliance and preventative measures anyway when it comes to taking care of food preparation and hand washing and sanitization of the equipment in the kitchen. So, you know, we do that as a routine basis anyway. But when we first heard about all of this in our community, in an abundance of caution, all of our schools were thoroughly cleaned, focusing on those high-touch areas, so talking about kitchens and bathrooms, with a solution that kills hepatitis A virus. All of our buses are being treated with the same solution that kills the hepatitis A virus. So, you know, we've been very proactive in this. When we first heard about it too, we posted information on our district website. We put out an all call to all district employees and an all call to all families of the Martin County School District. We sent out an email providing information about hepatitis A, what you need to do. And again, I reiterate and go back, wash your hands, wash your hands, wash your hands. And it's important for children to know to wash their hands. And we reinforce that as well at school. So my staff has been involved in all of the updates, the EOC meetings that they've had, keeping that in the forefront. For children, hepatitis A is part of the vaccine series that children receive. And I urge parents that if you are in doubt, if your child has been vaccinated for hepatitis A, to contact your pediatrician. Because I think that it's part of the series, but especially, and we see this outbreak, not just hepatitis A, but we can see this in the country about diseases that have been eradicated. And when we don't immunize our children, we see these outbreaks of not just hepatitis A, but you know that there's an outbreak of measles in our country. So there's a reason that we do have immunizations. And so I urge you, please have your children vaccinated and also contact your pediatrician. Thank you.
Are there specific years from what year to what year, say students in public schools should have been vaccinated? Is there any kind of set guideline for, you know?
Well, there are guidelines. They need to be vaccinated before they attend school. So that's a requirement that all children be vaccinated before entering school. And then there are boosters at, I believe it's before they get to middle school. I know there's a 7th grade booster. So I again urge parents to keep up with that and also contact their pediatrician when in doubt if they're not familiar with when their last booster or when they need to be immunized.
And I can further answer that. I think since 1995, it's been a considered standard of care for vaccination for children. And there is a 6-month booster that is required. So if parents have not had their child vaccinated, they should absolutely do that. But in our public school system, unless you do get a waiver and you do sign that you do not want your child vaccinated, they should have all been vaccinated.
From 1995 to what year?
Through today. It's been the standard of care.
Okay.
Yes.
But there's a chance though that some students may not have received the vaccination. That's correct? And do you know which ones haven't received it?
Well, they all bring immunization records unless they have a waiver. So we would not have a way of knowing whether hepatitis A on some child's immunization record. I mean, I'm not sure. I know that they bring their immunization records. To my knowledge, we have not gone to check every child's record at school of our 19,000 students to see if someone has missed hepatitis A. And that's why I think the easiest thing for parents to do would be to get on this right away, is to call your pediatrician and say, has my child been had the hepatitis A vaccine as part of their series.
Do you know what the cleaner was that you said was used?
Oh, I don't know the name of it, but I know that it kills hepatitis A virus.
So I think Commissioner Campy wanted to address things from the county level. Thank you. And I'll let you. Thank you. Oh, wait a minute, the sheriff.
No, Ed, come on up. So what we're going to do now, I think if all the questions are completed for our
I do have one more question on the vaccine.
About the so let's do this. Let's continue with these questions with our state and federal partners up here, and then we'll have our local officials with the our county commissioners and local people. Does that work for y'all? Okay, good. So we'll stay up and finish with yours.
Senator, you said that Mr. Sperber from St. Lucie County is coordinating efforts here locally. Why is it St. Lucie that's coordinating it and not the head of the health department in Martin County?
Currently, our director of the health department here locally retired several months ago, and we have an interim director. So the state has asked director, and she happens, the interim director is out of the country at this point on her honeymoon. So she is not here, and we wanted to make sure that we had coordination directly, especially across the counties, because Martin and St. Lucie are so interrelated, and we want to make sure that we have leadership and coordination.
Have you reached out to any other county?
Clint, can you talk us through the process that the health department's undertaken to identify the source?
If I can first answer the first question, as far as how many other county health department employees are helping out with this investigation, is the doctor mentioned through our state office, there are several individuals who are assisting. We have support from regional employees from Miami-Dade to St. Lucie County who are helping us have a better understanding as far as what the source is, as well as a few people from the health department in St. Lucie County. And the question was as far as identifying what the source is.
No, I'm more interested in the process. Talk us through the process that the local health officials have undertaken to identify the source.
Yeah. Before we go to that answer from the doctor, what I'd like to do is ask our Lieutenant Governor. She is on a time frame. We may be here all day, thanks to the courtesy of our wonderful sheriff, but the Lieutenant Governor is on a time frame. She's been so generous with her time. I'd like to ask her to make a closing comment before she leaves.
And again, thank you, Senator Harrell, for hosting this, and the question earlier about why are we here. And again, I cannot reiterate enough that Governor DeSantis and I are monitoring this situation. We're working with our health department. We're making sure that counties have access to information. We're deploying additional resources as needed. And this investigation, as the doctor indicated, is going to be a painstaking and very thorough investigation. But we are working day in and day out. We're communicating. We're making sure that we're providing real-time updates and as much information as needed to allay the concerns of the community. And that's really our focus. We want to make sure the community understands that we're working very thoroughly, that there are ways to prevent this, and that we're going to continue to pushing forward and making sure that the health and well-being of our hardworking Floridians is protected, and that the department is very much focused on addressing this issue, not just here, but throughout the state. So thank you all so very much.
Thank you so much for being here. We certainly appreciate that. So we had an additional question for...
Several people have mentioned that if it's appropriate. I'd like to know, who is it appropriate for? Who should get that vaccine? And if you do get that vaccine, does that mean that you are immunized from, you cannot get hepatitis A? Is it still possible to get it if you've had the vaccine?
Doctor.
So, oh, that's not the governor's. We have an extra phone up here. I want to make sure we did that. It wasn't Dr. Lieutenant Governor's phone. Talking about the vaccine, the vaccine is first of all recommended for anyone who has been a close contact of a known hepatitis A case. People who have underlying health conditions like liver disease, kidney disease, or a weak immune system for a variety of reasons. People who are homeless, people who have injection drug use or drug use, people who travel to other countries where hepatitis A is common, and individuals who have HIV, and people who also adopt children from countries where hepatitis A is common. So those are the core groups where definitely, if you belong to any of those groups, you want to talk to your doctor about getting vaccinated.
But if you are a healthy adult, does that mean you don't need the vaccine, or it's not recommended? How would you word that?
Anyone, the vaccine is very safe. So then it becomes more of a personal choice to talk to your doctor about whether it makes sense for you to get vaccinated. It is a safe vaccine, and the one dose of the vaccine provides immunity anywhere from a few years to even up more than 10 years, and 2 doses of vaccine, which of course is the gold standard, we believe has a really long protection.
Well, again, if it's $145 to get it at Cleveland, what about other places? Because that's a lot of money for people that are homeless, HIV, maybe drug users.
It is available through the health department for the uninsured and underinsured.
Where?
And at the local health department. Is that?
Across, yeah. It's an integrated Department of Health. We have 67 county health departments throughout the state. So as the message was discussed before the Lieutenant Governor, this would be for any resident of Florida that could follow up at their local health department for the uninsured or underinsured. And that goes as well with Martin County.
Does that mean the vaccine is free at the health department?
As far as the eligibility of it, yes, it is, if you meet that criteria.
Also, it is available at pharmacies. If you feel that you do not need to see your doctor or do not have one, you can also go to a pharmacy. They do vaccinations at pharmacies now. So I know we wanted our county commissioner to address the county perspective on this.
And as Commissioner Campy comes up, anybody else from our local delegation? I see our county administrator, Jan Krista, in the back, if she'd like to come up. Our school superintendent may still be up here. Doctor, you have been the star of the show today. I would suggest you stay here with us. So with that, I think most of our local representatives are up here. Commissioner Campy, Chairman of the Board of County Commissioners.
My colleagues, local colleagues, could join me, please. I'd appreciate it. Ladies and gentlemen, good morning, and we appreciate you coming. I'd like to introduce, we have Commissioner Jenkins, Harold Jenkins, represents Hope Sound to Indiantown. Commissioner Stacy Hetherington, sort of the center of the county, portions of Stewart, Rocky Point, Tropical Farms, correct?
Downtown Stewart.
Downtown Stewart. And we have several members of the City of Stewart Commission, the Mayor Becky Bruner, Kelly Glasslight you saw originally, Mike Myers is here as well, our county administrator. We're sort of the local face, if you will, and I appreciate that Superintendent Gaylord had an opportunity as a parent with children in the school district. I'm very happy to hear I'm not surprised, but I'm very happy to hear the measures that the school district has been taking. As the local face of this issue, we want to just take a moment and pause to remember why we're here. We're here because of Jeff Kirsch, his wife Nancy, and also for Lee Collins. These are Palm City residents. These were friends of ours. These were our neighbors, and they've lost their lives in this issue. I think that's what's really elevated this to the level of having so many of you come this morning. Many of us were also taking part in the news conference last week and have also sensed the same frustration. As local elected officials, we are the ones that get the phone calls, or more importantly, see our constituents in church, in the supermarket, at our places of employment, and people are concerned, and rightfully so. Now, we are a resilient community, so we will obviously get through this, but we are also a community that is an educated population that wants answers and that expects to have information. I have been concerned with what I'm calling an information vacuum, and you're familiar with that, and I don't blame any of you here because I know that the news media has worked very diligently on trying to fill in the gaps. But an information vacuum allows misinformation to pull in when accurate and timely information is not available. And that's what we're seeing. Many of us are very active on social media platforms, not just the traditional ones like Facebook and Twitter and website pages, but locally there's most of you are familiar with something called Nextdoor, or even in Palm City there's a large group called Palm City Moms. And sadly, some of the information that I've been reading on those websites is inaccurate because people are concerned and they'll hear something, it's a rumor, and they'll post it, and people that are growing up with that social media, they don't understand the difference between accurate traditional media and something that their next door neighbor might have posted because they heard it at work. So I'm very appreciative, and all of us are, for this opportunity to come and discuss this, because in Palm City in particular, this is a very serious issue for us. When we hear rumors or read rumors on social media that this restaurant or that restaurant is where it started, those rumors can put people out of business. Those rumors can, have all of a sudden a location that had 20 employees go to 0 or cut their staff in half. Now people are unemployed. So there's more to the issue. We're not doctors. None of us we have one. We're not doctors, but we are the ones that are handling this, as well as the fact that we're living with all of you in the community where this is happening. There's been questions about pets. There's been questions about, the incubation and how long do we wait to get the vaccines. Hand washing, I agree, is a fantastic option, but we also have to be concerned if the person that's preparing our food was washing their hands. So the concept of using the Department of Business and Professional Regulation, I used to own a food establishment. I know that the state handles those inspections and those notifications to restaurants and food handlers. To me, that's very important. But what we're trying to do here, and I appreciate Senator Harold and the sheriff giving us time to do this, because if we don't handle this information accurately, people will make information up. They're starved for information. So what I would ask our colleagues in the health department is that starting Monday, that we have Monday, Wednesday, and Friday updates. Now, if there's nothing to update, I would expect a press release that says there is no new information to update. But the news media and those of us that are on the front lines as elected officials should not have to wait and wonder what's happening. When people contact my office and all of my colleagues' offices and ask very legitimate questions and we don't have the answers, that doesn't work for us. So we'll need to have that information. I know they're working hard on it, and I know that there's HIPAA laws involved, but I would not be opposed to seeing some kind of patterning or mapping to find out where some of these cases are. When all of the deaths are from the small area of Palm City, you can imagine that Palm City residents are concerned. But if it happens in Hobe Sound or in the city of Stuart, then everyone's going to be concerned. I think it's reasonable when the health department is ready, and I very much appreciate the Lieutenant Governor coming down and Congressman Mast. I happened to contact Brian Mast, called him on the phone. He was very proactive. He got involved. He said he would call back. He spoke to the governor. He contacted us again, and I think some of what we've seen today, we have very involved state officials. Gail Harrell's been around for a long, long time, Senator Harrell. Toby Oberdorf, Congressman Mast, and I all happen to live in Palm City. Ms. Krista lives in Palm City. Members of the sheriff's staff live in Palm City. So this is very personal to us. So we appreciate the opportunity to get the information out. If you want to ask any of us local elected officials or our administrator, I know that the fire chief is here as well. We're the ones that are, obviously getting these questions first. We'd be more than happy to answer any questions. Thank you very much. And if my colleagues are interested in saying something to give their perspective, I would invite them.
Any questions for our local county commissioners? And I don't know if our mayor wants to address the city of Stuart.
I just wanted to say that was very eloquently put, Commissioner. And I like what the sheriff said, that he would offer whatever that he can offer. And I just want to say we at the city want to offer any resources that we can offer. We're all working together in one accord. And so I appreciate all the help we've got, Doctor, and all the questions that have been answered. Thank you.
Are there any last questions? Y'all have been very gracious. I always look at the media as our partners. You know that I have, through my years here, and some of my friends in the media like to point it out to me, I tend to be more open and more quick to release data than others. I think information is knowledge. I've already had a chat with the health department. I think it would be very beneficial, at least for rumor control, for us to know where in Martin County these are occurring. I've heard several times people pushing back against creating a panic. I think lack of knowledge and ignorance is much more likely a fire starter for panic than information. I think tell us what's going on, show us what you're doing, tell us where these are occurring, Tell us what you're working on and let us deal with it. If people in Martin County choose to pour gasoline on their head and run around on fire because they know the truth, that's their option. If, on the other hand, what I think will occur is that the majority of Martin County will be satisfied once they have a feel for what's going on and convinced that we are doing all we can. My offer to supply detective stands, they can go through credit cards, see if there's a common restaurant somewhere. We can use we have a variety of methodologies that we can use to get the information out, keep it confidential, and give it right back to the health department for their use. So with that, on behalf of the taxpayers of Martin County that bought and paid for this building and paid for the air conditioning.
Not that much air conditioning.
You know what, you can please some of the people some of the time. You all have a great day. God bless, and thank you so much.
And I would like to thank you all too for being here and for disseminating all this information. We are here to assist in any way, and I can tell you I was so delighted that the Lieutenant Governor did come and visit with us. I think this is very reassuring to us to hear directly from the Governor's office. And my office is open at all times to be of assistance to you, to really make sure that we are addressing this problem as it should be. Thank you very much for being here today.